Welcome to Ageless Health. Today we're tackling a topic of immense importance for anyone living with diabetes: how specific nutrients can play a pivotal role in managing blood sugar, supporting overall health, and mitigating the long-term complications associated with this condition. Diabetes, whether type 1, type 2, or prediabetes, requires diligent management that typically involves medication, dietary adjustments, and regular physical activity. However, what often gets overlooked is the powerful supportive role that certain vitamins can play. These aren't magic bullets to replace your prescribed treatments, but rather essential allies that can enhance your body's natural ability to regulate glucose, improve insulin sensitivity, and protect against the cellular damage that high blood sugar can inflict. Today, we're going to dive deep into the top 3 vitamins every diabetic should seriously consider taking to help lower blood sugar and safeguard their health. This isn't just about supplements. It's about understanding the fundamental biochemical processes in your body and how these vital nutrients can optimize them. The journey of managing diabetes is often complex and challenging. High blood sugar, if left unchecked, can lead to a cascade of devastating complications, affecting the eyes, kidneys, nerves, and heart. Even with conventional treatments, many individuals struggle to maintain consistently optimal glucose levels. This struggle is often compounded by nutrient deficiencies that can either contribute to insulin resistance or hinder the body's protective mechanisms against oxidative stress and inflammation. Our modern diets, even those considered healthy, can sometimes fall short in providing the optimal levels of certain micronutrients, especially when the body is under the metabolic stress of diabetes. That's why a targeted approach to supplementation, guided by scientific evidence, can be a game changer. These 3 vitamins aren't obscure compounds. They are well-researched, widely available, and have demonstrated significant potential in supporting diabetic health. Let's begin with our first indispensable vitamin for diabetics: vitamin D. Often lauded for its role in bone health, vitamin D's influence extends far beyond the skeletal system, playing a profound and multifaceted role in glucose metabolism and insulin sensitivity. You might be thinking, vitamin D? I thought that was for bones. But the scientific community is increasingly recognizing it as a crucial, hormone-like substance that impacts nearly every system in the body, including the endocrine system responsible for blood sugar regulation. For diabetics, understanding its function can unlock a powerful tool in their management arsenal. The primary mechanism linking vitamin D to diabetes management is its impact on insulin sensitivity and secretion. Insulin is the hormone responsible for ushering glucose from the bloodstream into our cells for energy. In type 2 diabetes, cells become resistant to insulin's signals, leading to higher blood sugar. Vitamin D receptors are present in the beta cells of the pancreas, which are responsible for producing and secreting insulin. Adequate vitamin D levels are believed to support the healthy function of these beta cells, potentially improving both insulin secretion and the body's sensitivity to insulin. Studies have shown a strong correlation between vitamin D deficiency and an increased risk of developing type 2 diabetes, as well as poorer glucose control in those already diagnosed. It's not a coincidence. It's a fundamental biochemical connection. Beyond its direct effects on insulin, vitamin D also exerts powerful anti-inflammatory and immunomodulatory effects. Chronic low-grade inflammation is a hallmark of insulin resistance and type 2 diabetes. This inflammation can damage pancreatic beta cells and further impair insulin signaling in target tissues. By reducing systemic inflammation, vitamin D helps protect these vital cells and pathways, creating a more favorable environment for glucose regulation. For individuals with type 1 diabetes, which is an autoimmune condition, vitamin D's immune-modulating properties are also of significant interest. While it cannot cure type 1 diabetes, maintaining optimal vitamin D levels may play a supportive role in managing the autoimmune response and potentially mitigating certain complications. The prevalence of vitamin D deficiency in the general population is high, and it's even more pronounced in individuals with diabetes. Factors like reduced sun exposure, age, skin pigmentation, and obesity can all contribute to lower vitamin D levels. For diabetics, this deficiency can create a vicious cycle. Lower vitamin D levels contribute to poorer glucose control, which in turn can exacerbate various health issues. That's why screening for and correcting vitamin D deficiency is a critical, yet often overlooked component of diabetic care. A simple blood test for 25-hydroxyvitamin D, 25-OHD, can reveal your status. Optimal levels for diabetics are generally considered to be in the range of 30 to 60 ng per ml, or 75 to 150 nmol per liter, with some experts suggesting even higher levels for therapeutic benefits. If your vitamin D levels are found to be deficient or insufficient, supplementation is often necessary, especially for diabetics. While sensible sun exposure and dietary sources like fatty fish, salmon, mackerel, and fortified foods can contribute, they are often not enough to achieve optimal levels, particularly in older adults or those with higher body mass. The recommended daily allowance, RDA, is typically 600 to 800 IU for adults, but many studies and clinicians recommend higher doses, often between 1,000 to 4,000 IU, or even more for initial correction of severe deficiency, under medical supervision, to reach and maintain optimal blood levels. Always choose vitamin D3, cholecalciferol, as it is the most effective form, and take it with a meal containing some fat to maximize absorption, as it is a fat-soluble vitamin. Regular retesting of your blood levels is crucial to ensure you're in the optimal range without oversupplementing. Moving on to our second essential vitamin for diabetics, vitamin B1, thiamine. This might surprise some, as vitamin B1 doesn't often grab headlines like vitamin D, but its role in glucose metabolism and protecting against diabetic complications is incredibly vital and often critically overlooked. Thiamine is a water-soluble vitamin essential for converting carbohydrates into energy. It acts as a coenzyme in several metabolic pathways, including the breakdown of glucose. Without sufficient thiamine, your body struggles to efficiently process glucose, which can contribute to higher blood sugar levels and the accumulation of harmful byproducts. The critical issue for diabetics concerning thiamine is that diabetes itself can lead to thiamine deficiency, creating a detrimental feedback loop. High blood glucose levels cause increased excretion of thiamine by the kidneys, meaning diabetics often lose more thiamine than non-diabetics. Additionally, some common diabetic medications, such as metformin, have been linked to reduced thiamine absorption. This combination of increased loss and potentially reduced absorption means that many diabetics are unwittingly living with a functional thiamine deficiency, even if their dietary intake seems adequate. This deficiency can then contribute to many of the most feared diabetic complications. One of the most significant roles of thiamine for diabetics is its protective effect against vascular damage and diabetic neuropathy. Chronic high blood sugar leads to the formation of advanced glycation end products, AGEGs, which are harmful compounds that accumulate in tissues and contribute to inflammation, oxidative stress, and damage to blood vessels and nerves. Thiamine, and particularly its more bioavailable synthetic derivative, benfotiamine, helps block these damaging pathways. It essentially redirects toxic glucose metabolites away from pathways that produce AGEGs, thereby protecting the delicate cells lining blood vessels, endothelial cells, and nerve cells. This protection is crucial for preventing or slowing the progression of diabetic retinopathy, eye damage, nephropathy, kidney damage, and neuropathy, nerve damage, leading to pain, numbness, and tingling, especially in the feet and hands. Standard thiamine supplements can be effective, but for diabetics, the fat-soluble derivative benfotiamine often offers superior benefits. Benfotiamine is more easily absorbed and has higher bioavailability than water-soluble thiamine, allowing it to reach and concentrate in cells where it's needed most to exert its protective effects against AGEs. This makes benfotiamine particularly effective for addressing diabetic complications. While the typical RDA for thiamine is around 1.1 to 1.2 milligrams, therapeutic doses of benfotiamine often range from 150 to 300 milligrams daily for diabetics, and even higher doses have been used in some clinical studies, always under medical guidance. This is a vitamin that diabetics simply cannot afford to ignore, especially given its role in protecting against the very complications that make diabetes so debilitating. Our third powerhouse vitamin for diabetics is alpha-lipoic acid, ALA. While technically an antioxidant and often discussed as an antioxidant, it's a vitamin-like compound that plays such a critical role in glucose metabolism and nerve health that it absolutely belongs on this list of essential supplements for diabetics. Alpha-lipoic acid is unique because it's both water-soluble and fat-soluble, allowing it to work throughout the entire body, both inside and outside cells. This broad reach makes it an incredibly potent protector against oxidative stress, a major contributor to diabetic complications. The primary ways ALA helps diabetics are through its effects on insulin sensitivity and diabetic neuropathy. ALA has been shown to improve glucose uptake by cells, mimicking some of the effects of insulin. It helps activate AMP-activated protein kinase, AMPK, an enzyme that plays a crucial role in cellular energy metabolism and can improve insulin sensitivity in muscle and fat cells. This means your body can use insulin more efficiently to move glucose out of the bloodstream, leading to lower blood sugar levels. For individuals with insulin resistance, this improvement can be profound, potentially reducing the need for certain medications or improving their effectiveness. Perhaps even more renowned than its blood sugar-lowering effects is ALA's demonstrated ability to alleviate symptoms of diabetic neuropathy, particularly painful peripheral neuropathy. As we discussed with thiamine, high blood sugar damages nerves through oxidative stress and impaired blood flow. ALA, with its powerful antioxidant properties, directly combats this oxidative damage. It helps regenerate other antioxidants, like vitamin C and E and glutathione, further amplifying the body's protective capacity. Clinical studies have shown that high doses of ALA can significantly reduce symptoms like pain, burning, numbness, and tingling in the feet and hands of individuals with diabetic neuropathy. It is even approved as a treatment for diabetic neuropathy in some European countries. While ALA is found in small amounts in foods like spinach, broccoli, and red meat, the therapeutic doses needed for managing diabetes and neuropathy are far higher than what can be obtained through diet alone. Supplementation is typically required. Doses for improving insulin sensitivity and blood sugar control often range from 300 to 600 milligrams daily. For treating diabetic neuropathy, studies have used doses of 600 milligrams or even higher daily, usually taken on an empty stomach to maximize absorption. Always consult your healthcare provider before starting ALA, as it can lower blood sugar and may require adjustments to your diabetic medications. There are two forms of ALA, RALA and SALA. RALA is the naturally occurring form and is generally considered more biologically active, though many supplements contain a racemic mixture of both. Choosing a high-quality RALA or stabilized RALA supplement can offer enhanced benefits. Let's briefly touch upon the synergy between these three vitamins. Imagine them as a team, working together to support your diabetic health. Vitamin D optimizes insulin function and reduces inflammation. Thiamine, or benfotiamine, protects against advanced glycation end products and nerve damage. Alpha-lipoic acid improves insulin sensitivity and provides powerful antioxidant protection against neuropathy. Each vitamin addresses a different, yet equally critical aspect of diabetic pathology. By ensuring optimal levels of all three, you're not just taking individual supplements, you're creating a robust, multi-pronged defense system against the challenges of diabetes. This holistic approach empowers your body to better manage glucose, protect its delicate tissues, and maintain overall vitality. It's crucial to reiterate that these vitamins are supportive tools, not replacements for your prescribed diabetes medications, dietary management, or lifestyle changes. They are meant to work alongside your conventional treatment plan, potentially enhancing its effectiveness and reducing the risk of complications. Always, and I mean always, discuss any new supplements with your healthcare provider or a registered dietitian who is knowledgeable about diabetes. They can help you determine the appropriate dosages, identify potential interactions with your medications, and monitor your progress safely. Self-medication with high doses of any supplement can be risky, so professional guidance is key. Beyond these top three, other nutrients certainly play a role in diabetic health, such as magnesium, chromium, and B vitamins in general. However, vitamin D, thiamine, especially as benfotiamine, and alpha-lipoic acid stand out due to the depth of research supporting their specific and powerful benefits directly related to blood sugar control and the prevention of diabetic complications. They address fundamental metabolic dysfunctions and protective needs unique to individuals living with diabetes. Making sure you are replete in these three nutrients can provide a foundational layer of support for your diabetic management. Consider the long-term impact of consistently optimizing these vitamin levels. Diabetes is a chronic condition that requires continuous vigilance. The insidious nature of high blood sugar lies in its slow, cumulative damage over years. By proactively addressing potential nutrient deficiencies and supplementing with these targeted vitamins, you are actively protecting your eyes, kidneys, nerves, and heart from this damage. You are giving your body the best possible chance to thrive, to maintain energy, and to avoid the life-altering complications that can accompany diabetes. This isn't about avoiding aging. It's about embracing ageless health, maintaining your quality of life, and living fully despite your diagnosis. The financial and emotional toll of diabetic complications can be immense. Investing a small amount in high-quality, targeted vitamin supplementation under professional guidance can be seen as a proactive, preventive measure that saves you far more in potential future medical costs and suffering. It's about empowering yourself with every available tool to manage your condition effectively and live a healthier, more vibrant life. Remember, knowledge is power, and applying that knowledge consistently is the key to success in diabetes management. So, for every diabetic watching, please take this information to heart. Get your vitamin D levels checked. Consider supplementation, especially if deficient. Discuss benfotiamine and alpha-lipoic acid with your doctor. These are not minor players. They are fundamental allies in your fight against high blood sugar and the complications of diabetes. Empower yourself with these essential vitamins and build a stronger, more resilient foundation for your health. If this comprehensive exploration of the top three vitamins for diabetics has provided valuable insights and empowered you, please give this video a thumbs up and subscribe to Ageless Health for more evidence-based strategies to optimize your well-being and live your best life at any age. We are committed to bringing you actionable advice that truly makes a difference. And if you have any questions or personal experiences with these vitamins that you'd like to share, please leave them in the comments below. We love hearing from our community. Until next time, stay informed, stay proactive, and live with enduring health. You are absolutely worth it. Thank you for watching Ageless Health. Subscribe to stay healthy every day.